ਦਿਨੋ ਦਿਨ ਕੋਰੋਨਾ ਵਾਇਰਸ ਦੇ ਵੱਧ ਰਹੇ ਪ੍ਰਕੋਪ ਦੇ ਚੱਲਦਿਆਂ ਓਨਟਾਰੀਓ ਦੇ ਹੈਲਥ ਅਧਿਕਾਰੀਆਂ ਵੱਲੋਂ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਕੀਤੀ ਗਈ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਪ੍ਰੋਵਿੰਸ ਵਿੱਚ 991 ਲੈਬੋਰੇਟਰੀ ਕਨਫਰਮ ਕੇਸ ਨੇ, ਪਰ ਪ੍ਰੋਵਿੰਸ ਵਿੱਚ ਬੀਤੇ ਦਿਨ 2 ਮੌਤਾਂ ਵੀ ਹੋਈਆਂ ਨੇ ਜਿਨ੍ਹਾਂ ਦਾ ਟੈਸਟ ਨਹੀਂ ਕੀਤਾ ਗਿਆ ਸੀ। ਇੱਕ ਮੌਤ ਯਾਰਕ ਰੀਜਨ ਵਿੱਚ ਹੋਈ ਹੈ। ਇਸੇ ਤਰ੍ਹਾਂ ਹੀ ਹੁਣ ਤੱਕ ਕੁੱਲ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ 993 ਬਣਦੀ ਹੈ। ਪ੍ਰੋਵਿੰਸ ਵਿੱਚ 60 ਮਰੀਜ਼ ਹਸਪਤਾਲ ਵਿੱਚ ਦਾਖਲ ਨੇ ਅਤੇ 32 ਵੈਂਟੀਲੇਟਰ ਤੇ ਨੇ।
So as of this morning we now have a total of 991 laboratory confirmed cases of COVID-19 in Ontario. In addition, we have been notified of 2 deaths related to the outbreak of COVID-19 at Pinecrest Nursing Home in Popcajun. Now, these cases were not laboratory confirmed. However, they are included as part of our total numbers because we have already received confirmation that COVID-19 was the cause of the outbreak in the home. And this is in keeping with our provincial outbreak guidelines for all respiratory infections. In addition, we have been notified of a death in York Region involving a woman in her 80s, which brings our total number of deaths at this point that we are aware of to 18. And it brings the total of cases in Ontario to 993, which is an increase of 135 from yesterday. We do expect the number of resolved cases to go up quite a bit, well over 200 over the next few days. In terms of exposure, we are missing data still on about 40% of cases as the public health units continue to do their work. Of those we know about, a third had traveled in the 14 days before becoming ill. And it's the most common source of exposure has been in the United States. At this point, the United States has more cases than China did, 85,500 roughly, as compared to 81,340 in China. The second most common source is Europe. 10% of the cases had close contact with a confirmed case, and 16% had neither. So again, evidence of community transmission. We are aware at this point of approximately 60 cases who are hospitalized, and of those, 43 are in the intensive care unit. Of those 43, 32 are on ventilators.
ਓਨਟਾਰੀਓ ਦੇ ਹੈਲਥ ਅਧਿਕਾਰੀਆਂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਦੁੱਖ ਦੀ ਗੱਲ ਇਹ ਹੈ ਕਿ ਲਗਾਤਾਰ ਮੌਤਾਂ ਵਧ ਰਹੀਆਂ ਨੇ ਅਤੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਸੈਂਟਰ ਰਿਸਕ ਤੇ ਨੇ, ਜਿਨ੍ਹਾਂ ਵੱਲ ਖਾਸ ਧਿਆਨ ਦਿੱਤਾ ਜਾ ਰਿਹਾ ਹੈ। ਉਹਨੇ ਕਿਹਾ ਹੈ ਕਿ 2 ਦਿਨ ਪਹਿਲਾਂ 170 ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਏ ਸਨ, ਬੀਤੇ ਦਿਨ 133 ਹੈਰਾਨੀਜਨਕ ਹੈ, ਪਰ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ ਆਉਣ ਵਾਲੇ ਦਿਨਾਂ ਵਿੱਚ ਰੋਜ਼ਾਨਾ 200 ਤੱਕ ਵਧੇਗੀ। ਹੈਲਥ ਅਧਿਕਾਰੀਆਂ ਦੇ ਮੁਤਾਬਕ 940 ਟੈਸਟਾਂ ਦੇ ਰਿਜ਼ਲਟ ਅਜੇ ਪੈਂਡਿੰਗ ਨੇ ਅਤੇ ਵੀਕਐਂਡ ਤੱਕ 5000 ਟੈਸਟ ਰੋਜ਼ਾਨਾ ਕੀਤੇ ਜਾਣਗੇ।
Just in there, because we were talking about the couple things. The deaths, unfortunately, are continuing. In that, still in the high-risk category, mostly. Some related to the long-term care facilities that we update and continue to monitor in that aspect. So still dealing with an at-risk population that has been clearly noted. The lab testing, as yesterday, we remember I was talking about we went from 100 up to 170. We're down to 133. So that's a pleasant surprise to me. And added to the fact that we only did that, we also dropped the number pending by 940. So that was also an improvement, starting to make headway and move on those lab tests as more and more of our satellite laboratories are coming on board following their quality assurance checks with the Public Health Ontario Laboratory. So that means yesterday we went through nearly 3,500 tests. We wanted to be at 3,000 early by midweek, and I guess we've made that. And we want to try and move that up to close to 5,000 perhaps by the weekend. So we're optimistic that we can keep that progression going and keep dropping the pending tests down lower and lower. So the number of tests carried through, as well as the rollback on the pending ones, I was anticipating that our number would be higher than 170. So I am pleasantly surprised it's 133. I would say that's okay. Let's see where we go. It's only one day, and see how we're going to do over the weekend. As I said, this is now the second week of the critical 2 weeks I was talking about, and we have continued to do well in that regard as far as everybody adhering to the social distancing, physical distancing. The time is sometimes to get casual on that. Do not do that. Stick to staying at home. Sit outside in the sun for a little bit and do other things and activities, keeping to smaller groups and keeping down to the distancing between especially non-family members if you're not in isolation in a family unit. If you're already in isolation because you're a case, you still have to do that distancing with your family members to try and prevent them from becoming cases. And that is another whole aspect that we've asked all along. There's a difference between isolation of your case versus a self-isolation in the house and monitoring those aspects. Of course, ongoing issues around hand hygiene is critical, as well as cough etiquette, etc.
ਅਲਬਰਟਾ ਦੀ ਹੈਲਥ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਹਿੰਚਾ ਨੇ ਦੱਸਿਆ ਹੈ ਕਿ ਪ੍ਰੋਵਿੰਸ ਵਿੱਚ ਬੀਤੇ ਦਿਨ 56 ਨਵੇਂ ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਏ ਨੇ ਅਤੇ ਕੁੱਲ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ 542 ਹੋ ਗਈ ਹੈ। ਉਹਨਾਂ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਕਿ ਮੈਗੈਂਜੀ ਟਾਊਨ ਕੇਅਰ ਸੈਂਟਰ ਵਿੱਚ 2 ਕੇਸ ਪਾਏ ਗਏ ਨੇ ਅਤੇ ਬੀਤੇ ਦਿਨ 8 ਕੇਸ ਕਮਿਊਨਿਟੀ ਟਰਾਂਸਮਿਸ਼ਨ ਨਾਲ ਸੰਬੰਧਿਤ ਸਾਹਮਣੇ ਆਏ ਨੇ। ਅਲਬਰਟਾ ਅੰਦਰ 23 ਮਰੀਜ਼ ਹਸਪਤਾਲ ਵਿੱਚ ਦਾਖਲ ਨੇ, ਜਿਨ੍ਹਾਂ ਵਿੱਚੋਂ 10 ICU ਵਿੱਚ ਨੇ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ 15 ਤੋਂ ਜ਼ਿਆਦਾ ਲੋਕ ਇੱਕ ਥਾਂ ਤੇ ਇਕੱਠੇ ਨਹੀਂ ਹੋ ਸਕਦੇ ਅਤੇ 15 ਲੋਕਾਂ ਲਈ ਵੀ 2 ਮੀਟਰ ਦਾ ਫਾਸਲਾ ਬਣਾ ਕੇ ਰੱਖਣਾ ਲਾਜ਼ਮੀ ਹੈ।
Today, as you have heard, we are announcing new measures to slow the spread of COVID-19. First, I want to report that we have confirmed, as Premier mentioned, 56 new cases of COVID-19 in the province. This includes 2 new cases at the Mackenzie Town Long-Term Care Facility, which brings the total number of cases at this facility to 15. There have now been 542 cases identified in our province. We suspect up to 42 of these total cases may be community transmission from an unknown source, which is an increase of 8 from yesterday. Currently, 23 individuals are being treated in hospital, 10 of those in the ICU. I'm pleased to share that we can confirm that 33 Albertans have recovered, an increase of 6 from yesterday. These recoveries are included in the 542 total cases. As you know, our approach since we learned of this virus has been to very closely assess the situation in our province and respond accordingly to protect the health of Albertans. This response already includes aggressive public health measures and a higher rate of testing than any other province in Canada. These are important steps. Yet even with these measures in place, we are still observing increases in cases confirmed in every age group. The number of cases of community transmission in the province is steadily rising. Across Canada, over half of all new cases are now linked to spread in the community. Stronger intervention measures are needed now to slow the spread of this virus. Premier Kenney already shared that effective today, all gatherings in the province must be limited to 15 people or fewer, and social distancing of 2 meters must be observed. Additionally, Albertans are restricted from accessing close contact services. A complete list of services affected is available on the alberta.ca website. It is important to remember that even when a gathering is smaller than 15, Albertans must still follow all public health measures that we've put in place. No matter where you are or what you're doing, practice social distancing by staying 2 meters apart at all times. No matter the work site or gathering place, take steps to make sure that anyone who is ill does not attend. If you are feeling unwell, you must stay home.
ਛੋਟੇ ਬਿਜ਼ਨਸ ਅਦਾਰਿਆਂ ਦੇ ਐਸੋਸੀਏਟ ਮਿਨਿਸਟਰ ਪ੍ਰਭਮੀਤ ਸਰਕਾਰੀਆ ਨੇ ਬਿਜ਼ਨਸ ਅਦਾਰਿਆਂ ਨੂੰ ਸਿੱਧਾ ਸੰਬੋਧਨ ਕੀਤਾ, ਜਿਸ ਵਿੱਚ ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਜੋ ਅਦਾਰੇ ਮਦਦ ਮੰਗ ਰਹੇ ਨੇ ਉਹ ਸਾਡੇ ਪਾਰਟ ਨੇ ਅਤੇ ਓਨਟਾਰੀਓ ਦਾ ਅਰਥਚਾਰਾ ਛੋਟੇ ਬਿਜ਼ਨਸ ਤੇ ਡਿਪੈਂਡ ਕਰਦਾ ਹੈ। ਇਸ ਦੇ ਲਈ ਸਰਕਾਰ ਹਰ ਸੰਭਵ ਮਦਦ ਲਈ ਤਿਆਰ ਹੈ। ਸਰਕਾਰੀਆ ਨੇ ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ ਚੁੱਕੇ ਗਏ ਕਦਮਾਂ ਦੀ ਵੀ ਸ਼ਲਾਘਾ ਕੀਤੀ ਅਤੇ ਕਿਹਾ ਕਿ ਸਾਰੀਆਂ ਸਰਕਾਰਾਂ ਮਿਲ ਕੇ ਕੰਮ ਕਰ ਰਹੀਆਂ ਨੇ। ਉਹਨਾਂ ਵੇਜ ਸਬਸਿਡੀ ਵਧਾਉਣ ਅਤੇ ਕਰ ਮੁਕਤ ਲੋਨ ਦੇ ਲਈ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਨੂੰ ਸ਼ੁਕਰੀਆ ਵੀ ਕਿਹਾ।
It's never been more important to keep the lines of communication with our small business community open. This is why virtual meetings and roundtables with various small business sectors have become a regular part of our day. And it's also why I'm grateful for the chance to speak directly to Ontario's small business community today. As you all know, on Monday, Premier Ford announced the mandatory closure of all non-essential workplaces. And we hear you when you tell us how difficult this is for so many of you. We hear you when you tell us that your small business supports your family of 5, or that 6 employees depend on you for paychecks each week. We hear you when you tell us that you are worried about your business's ability to brave this storm. We know it's not easy, and that many of you have put everything you have into building up your business. But we also hear you when you tell us that you support the steps we are taking, and that you want to do whatever you can to help stop the spread of COVID-19. Safeguarding public health is not only a healthcare priority, it's an economic priority as well. The best thing we can do for small businesses, for Ontario's competitiveness, and for the hardworking families eager to get back on the job is solve this healthcare challenge first and as quickly as possible. The sooner we're able to stop the spread of COVID-19, the sooner businesses can reopen, everyday social activities can resume, and Ontario's talented, skilled, and resilient workforce can get back to doing what they do best, innovating, manufacturing, and delivering made-in-Ontario goods to markets across Canada and beyond. Small businesses tell us they need help braving this storm, and Ontario is your partner. We depend on small businesses to drive our economy forward. This is why I am pleased that, as our first step, we have helped businesses focus on their families and immediate needs, while we work with our federal and municipal partners to take strong actions to support you. Working together, we are encouraged that the Prime Minister announced today that the federal government will be increasing the small business wage subsidy. This will put us in line with many of our European counterparts, and along with small business loans and other measures announced by our federal partners, will provide significant support. We look forward to seeing the full details of these measures in the coming days. Together with the Ontario Action Plan released this week, our small business community should be encouraged by the scale and scope of supports our joint efforts will provide. These are just first steps we are taking to help Ontario move forward. Ontario's small businesses are the lifeblood of our economy, and through the Ontario Together project, we've seen some businesses step out, help out in remarkable ways. Overcoming this challenge is going to take all hands on deck and bold plans like the Ontario Action Plan.
ਕੈਨੇਡਾ ਦੇ ਹੈਲਥ ਅਧਿਕਾਰੀਆਂ ਨੇ ਦੱਸਿਆ ਕਿ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਕਰਨ ਤੱਕ ਪੂਰੀ ਦੁਨੀਆ ਵਿੱਚ ਕੋਰੋਨਾ ਵਾਇਰਸ ਕੇਸ 5,30,000 ਤੋਂ ਪਾਰ ਹੋ ਚੁੱਕੇ ਨੇ ਅਤੇ ਕੈਨੇਡਾ ਵਿੱਚ 4,043 ਕੇਸ ਸਾਹਮਣੇ ਆ ਚੁੱਕੇ ਨੇ ਤੇ 39 ਲੋਕਾਂ ਦੀ ਮੌਤ ਹੋ ਚੁੱਕੀ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਬਹੁਤ ਲੋਕ ਅੰਡਰ ਇਨਵੈਸਟੀਗੇਸ਼ਨ ਵੀ ਨੇ, ਇਸ ਲਈ ਅੰਕੜਾ ਲਗਾਤਾਰ ਵਧੇਗਾ। ਉਹਨੇ ਵੀ ਦੱਸਿਆ ਕਿ ਕੈਨੇਡਾ ਵਿੱਚ 1,65,000 ਟੈਸਟ ਕੀਤੇ ਜਾ ਚੁੱਕੇ ਨੇ ਅਤੇ ਸੋਮਵਾਰ ਤੋਂ ਬਾਅਦ 65,000 ਟੈਸਟ ਕੀਤੇ ਗਏ ਨੇ, ਜਿਸ ਹਿਸਾਬ ਦੇ ਨਾਲ 1 ਮਿਲੀਅਨ ਲੋਕਾਂ ਪਿੱਛੇ 4300 ਲੋਕਾਂ ਦਾ ਟੈਸਟ ਹੋਇਆ ਹੈ। ਇਹ ਅੰਕੜਾ ਦੁਨੀਆ ਵਿੱਚ ਸਭ ਤੋਂ ਜ਼ਿਆਦਾ ਹੈ। ਉਹਨੇ ਵੀ ਕਿਹਾ ਕਿ 6% ਮਰੀਜ਼ ਹਸਪਤਾਲ ਵਿੱਚ ਨੇ ਅਤੇ 2.5% ਕ੍ਰਿਟੀਕਲ ਹਾਲਤ ਵਿੱਚ ਨੇ।
There are over 530,000 cases of COVID-19 affecting all countries. In Canada, there are 4,043 cases, including 39 deaths. These are based on up-to-the-minute COVID-19 laboratory testing results. But it is important to know that at any point in time, there are many other people under investigation, awaiting laboratory tests, or not being tested at all. For this reason, even if you are not hearing of cases in your community, it doesn't mean there are no cases or that there are no exposures waiting to happen. We have now tested over 165,000 people in Canada, which is more than 65,000 additional people tested since Monday. On a per capita basis, that's more than 4,300 per million population, one of the highest rates in the world. In terms of the severity of COVID-19 in Canada, the percentage of cases that require hospitalization remains at about 6%. Those who are critically ill account for about 2.5% of cases, and 1% of cases have been fatal. Severity and fatality rate aren't just a function of the virulence of the virus. The fatality rate will be higher among high-risk populations, which is why we must do all we can to protect the most vulnerable among us. Another cause of increased mortality is overwhelmed health services that are unable to provide intensive care to a high volume of critical cases. For this reason, we must all work to flatten the epidemic curve and protect the health system. New Zealand has introduced the concept of knowing and staying inside your bubble. This is a great way to conceptualize the zone of protection that we need to have around us to keep the virus out. The optimal protection comes when each person has their own separate bubble that is a 2-meter circumference around us. But for couples, families, and other cohabitation situations, that bubble might mean 2 or 4 or 6 people, all keeping within a bubble that no one else comes into. Whatever your situation is, stay in your bubble. And please, don't step outside of it and don't burst anyone else's bubble.
It is really for our American neighbors and allies to make announcements about their position. Having said that, we have continued our discussions very energetically. Yesterday and today, I was in touch last night and this morning with our Ambassador Hillman to the United States. Canada has continued to express clearly and forcefully its view that there is no logical reason to militarize our border with the United States. And we have been very clear also that such an action would damage our relationship.
ਟੋਰਾਂਟੋ ਦੇ ਮੇਅਰ ਜੌਨ ਟੋਰੀ ਵੱਲੋਂ ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ ਕੁਆਲੀਫਾਈ ਛੋਟੇ ਬਿਜ਼ਨਸ ਅਦਾਰਿਆਂ ਦੇ ਮੁਲਾਜ਼ਮਾਂ ਨੂੰ 75% ਦੀ ਤਨਖਾਹ ਦੇਣ ਦੀ ਸ਼ਲਾਘਾ ਕੀਤੀ ਗਈ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਤਿੰਨੇ ਸਰਕਾਰਾਂ ਲੋਕਾਂ ਦੀ ਸਹਾਇਤਾ ਲਈ ਕੰਮ ਕਰ ਰਹੀਆਂ ਨੇ। ਉਹਨਾਂ ਵੀ ਕਿਹਾ ਕਿ ਲੋਕ ਸ਼ਾਪਿੰਗ ਕਰਨ ਸਮੇਂ ਇਕੱਠ ਕਰ ਰਹੇ ਨੇ ਜੋ ਕਿ ਨਿੰਦਣਯੋਗ ਹੈ। ਮੇਅਰ ਦੇ ਮੁਤਾਬਕ ਕੁਝ ਲੋਕ ਕੋਵਿਡ-19 ਨੂੰ ਲੈ ਕੇ ਜੋ ਕ੍ਰੈਕ ਵੀ ਕਰਦੇ ਦੇਖੇ ਜਾ ਰਹੇ ਨੇ, ਇਸ ਨੂੰ ਸਹਿਣ ਨਹੀਂ ਕੀਤਾ ਜਾਵੇਗਾ।
May I begin today by applauding Prime Minister Justin Trudeau for announcing today that the Government of Canada will be covering 75% of wages for qualifying small and medium-sized businesses to avoid layoffs, and that this new assistance will be backdated to March 15th. This is good news for many workers and businesses and all the families who rely on them after a lot of bad news over the last few weeks. The Medical Officer of Health has educated me on the fact that this kind of anxiety caused by financial stress and so on can itself have health consequences for people who have enough health worries on their mind as it is. I should say that what was brought forward today by the Government of Canada was almost exactly what our tech, small business, manufacturing and restaurant sectors, just as examples, told me would help the most to save businesses and jobs. Alongside others, I conveyed these requirements and ideas to the Government of Canada, and I want to pay tribute in particular to Finance Minister Bill Morneau and to Deputy Prime Minister Chrystia Freeland for the fact that they closely listened to what everyone was saying and they acted on what they heard. It is a significant measure the federal government is uniquely poised to undertake, and it is definitely the right thing to do. These measures, also including the deferral of some payments to government, such as the HST, will be a lifeline which preserves jobs, preserves businesses, and helps to protect the economic success we were enjoying before the virus struck. Coupled with measures taken by the province in their economic update this week and actions the city has taken, including the 60-day grace period for City of Toronto tax, water, and waste utility payments for residents and businesses who need help, we are all working together, all three orders of government, to provide relief to people and to businesses. Time is of the essence, so I hope that all of us can deliver on all of these measures as soon as possible. We are all responding to tough times with right and responsible actions. That's what we all should be doing, and I know that's what so many people are doing across the city in their own lives, helping family and friends to get through this. That's the Toronto spirit, and that's how we will survive these difficult times. Although many people, I think, have responded to this pandemic in a positive way and as best one can, there are still cases that are frustrating and, quite frankly, outright disturbing. Chief Pegg will update you on enforcement action we are continuing to have to take for some non-essential businesses that have not closed. This is not optional. If you're not essential, if you are non-essential, you have to shut down to avoid further spreading of the virus and, quite frankly, to avoid sanctions. It puts our whole community at risk, and it shouldn't still be happening. We will continue to send our people out to all areas to make sure there is compliance with the rules that have been put in place based on the best medical advice and based as well, quite frankly, on respect for the law. I understand that some President's Choice, Loblaws, and Shoppers customers were advised in an email today that there are growing reports of people ignoring social distancing while shopping. Shopping in groups, bringing family to shopping as if it's a social outing of some kind, or even some people, just awful human beings, making jokes to some of the people working in those stores, doing good work for all of us, about being COVID positive. This kind of behavior is disrespectful, it's irresponsible, and when it comes to cracking jokes about the deadly virus, it is really just dangerous.
ओंटारियो ਦੇ ਹੈਲਥ ਅਧਿਕਾਰੀ ਨੇ ਦੱਸਿਆ ਹੈ ਕਿ ਸਿਟੀ ਵਿੱਚ ਹੁਣ ਤੱਕ 457 ਮਾਮਲੇ ਸਾਹਮਣੇ ਆ ਚੁੱਕੇ ਨੇ, ਜਿਸ ਵਿੱਚੋਂ 118 ਬੀਤੇ ਦਿਨ ਸਾਹਮਣੇ ਆਏ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ 29 ਲੋਕ ਹਸਪਤਾਲ ਵਿੱਚ ਨੇ, 15% ICU ਵਿੱਚ ਨੇ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ 25% ਕੇਸ ਕਮਿਊਨਿਟੀ ਟ੍ਰਾਂਸਮਿਸ਼ਨ ਨਾਲ ਸੰਬੰਧਿਤ ਨੇ, ਇਸ ਲਈ ਇਹ ਅੰਕੜਾ ਆਉਣ ਵਾਲੇ ਦਿਨਾਂ ਵਿੱਚ ਵੱਧਦਾ ਰਹੇਗਾ। ਹੈਲਥ ਅਧਿਕਾਰੀ ਨੇ ਲੋਕਾਂ ਨੂੰ ਅਪੀਲ ਕੀਤੀ ਕਿ ਉਹ ਸੋਸ਼ਲ ਡਿਸਟੈਂਸ ਬਣਾ ਕੇ ਰੱਖਣ ਅਤੇ ਗਰੋਸਰੀ ਖਰੀਦਣ ਨੂੰ ਸੋਸ਼ਲ ਆਊਟਿੰਗ ਨਾ ਬਣਾਉਣ। ਉਹਨੇ ਵੀ ਕਿਹਾ ਕਿ ਕੁਝ ਲੋਕ ਜਾਰੀ ਕੀਤੀਆਂ ਹਦਾਇਤਾਂ ਨੂੰ ਇਗਨੋਰ ਕਰਦੇ ਵੀ ਦੇਖੇ ਜਾ ਰਹੇ ਨੇ।
As of 1 o'clock this afternoon, there are 457 confirmed cases of COVID-19 in Toronto, and this is up 118 from yesterday. There are 29 cases hospitalized, 15 in ICU. Approximately 25% of the cases are attributed to community spread, and 18 people have recovered. These numbers are, as always, constantly changing, and they are indeed increasing. We are seeing a significant increase, and I expect that we will continue to see similar patterns in the coming days ahead. As I've recently stated, you can be infected with COVID-19 and not know it. For most people, it takes about 5 or 6 days before they show symptoms of illness. For others, it can take up to 14 days. And there can be a number of days from the time you show symptoms to when you get tested and then receive the results of the test. We also know that March break recently ended, and there's been an increased number of travelers returning back to our city, many of whom are returning from destinations where COVID-19 is actively circulating. What this means, taken all together, is that the positive tests that we're getting now are the result of infections that happened several days ago. This is why I continue to urge people to practice physical distancing. I continue to be troubled by some of the stories I hear of people who continue to ignore social distancing or physical distancing. As we've just heard from Mayor Tory, there are stories of people shopping for groceries and essential supplies in groups or as a family, treating shopping as a social outing. And while under normal circumstances, these kinds of actions may seem harmless, they are very concerning in our current situation. If we continue to see people selfishly ignore the recommendations that have been put in place to keep us safe, we should prepare to continue to see dramatic increases in local.
ਅੱਜ ਲਈ ਬਸ ਇੰਨੇ। ਹੁਣ ਤੁਸੀਂ ਮੈਨੂੰ ਮਨਦੀਪ ਕੌਰ ਖਾਲਸਾ ਨੂੰ ਦਿਓ ਆਗਿਆ। ਧੰਨਵਾਦ ਜੀ।